Leg would get short. Turn your head to the right. Right leg would look like you get short. So that's cervical or bilateral cervical syndrome. Head down to the middle, please. That has some associated findings. It's got a listing associated with it, etc. So the listing is that it's an occiput that's in extension. Typically, that's going to manifest itself as right rotation restriction, left rotation restriction, because the upper cervical spine mostly rotates. So the range of motion you'll actually see would be usually rotation. Maybe painful, maybe difficult, maybe both. Maybe neither. There's some associated tender spots. Students tend to miss this one with bilateral cervical syndrome for some reason. Typically, if you just palpate up both sides of the lamina pedicle junctions, you're going to find multiple areas of tender spots. C2 specifically can be tender on the spinous because it's the attachment of 2 of the 4 suboccipital muscles. And then if you just palpate along the suboccipital muscles generally, they tend to be taut and tender as well. All right, so that'd be walking through the leg check. So if you had a bilateral cervical syndrome, there's a couple things you need to do with that. Watch your head, because I'm going to move this down. You're going to angle this down 30 to 45 degrees or so to put the head in flexion a little bit. The occiput's stuck in extension. Let's put it in flexion to preload it. You can stand on either side of the table. There was one thing we paid attention to, depending on which side of the table you wanted to stand on. Who remembers what that was? If one of the sides of the occiput was more inferior than the other. If you got a low occiput on one side, that's the side you stand on. So you're going to evaluate, does it seem level or does it seem like it's in lateral flexion, essentially? And you're going to stand on the laterally flexed side. With this one, you're going to have the patient tuck their chin a little bit. You're going to use thenars on the back of the occiput. You get square to the patient, and your line of drive is going to be as much I to S as you can muster. One shot.